Okay, so this is for anatomy. The naming of the bones, specifically, we're going to be talking about the appendicular skeleton, the bones you need to be able to identify, and the parts of that to name them. So again, appendicular skeleton is pretty much your arms and your legs with your pelvic girdle and your pectoral girdle. Pectoral girdle is the bones that articulate in this shoulder area, so that would be your clavicle here, your humerus, and then your scapula. That's your pelvic girdle, and then, your pectoral girdle, and your pelvic girdle is your femur here and how it articulates with the pelvic bones. So appendicular, I'm going to point to them on the skeleton and then show you the individual bones and the parts you need to be able to identify. So again, here's the clavicle. Okay. The back side, we have the scapula. Okay, you have one on each side, clavicles and scapula. Here is your humerus, and down in your forearm, we have your radius and your ulna. Now, the radius, if you find your thumb, the radius is always right next to your thumb. So on this skeleton, here's the thumb, so that means the bone right next to it is the radius, okay? And as you pronate and you supinate your hand, you notice that the radius will kind of turn over the ulna there, okay? It radiates that way. It actually will rotate in this joint right here. So that's the radius, and this is the ulna, the other bone in the forearm, the ulna, and it articulates or forms a hinge joint with the radius. So this part of the ulna forms a joint with the radius, okay? Then you have your carpals, your wrist bones, there's 8 of them, and then you have your metacarpals, and then you have your phalanges, specifically your thumb is your pelvis. And the phalanges have, let me go to my sheet here, they have, okay, proximal, middle, and distal phalanges, okay? So that is your arm. On your bottom half here, here is a coxa, part of your pelvic bone. Here's another coxa. Each coxa is divided into 3 bones. You have your ilium right here, and then your ischium, that's like what you sit on. I was just touching the tailbone. Here's your ilium. And then your pubic bones meet in the middle here to form, this is the pubic symphysis where they join. There's some cartilage here. And then you have your femur, longest, biggest bone right there. You have your patella, size of my bone right there, it forms that knee joint. And then you have your tibia, the largest bone in your shin. Then you have your fibula, lateral to that. And then you have your tarsals, which are your ankle bones, specifically the calcaneus, that's your heel. The talus is what articulates with your tibia right here. And you actually have other tarsal bones that I'll show you. And then you have your metatarsals, and then you have phalanges. Those are your toes again. You have proximal, middle, and distal phalanges. So now let's go to the specific bones that you have to identify by themselves, and then specific parts of them. So let's start with the scapula. So we know it's the scapula because look at this weird shape, okay? It also has kind of like this sharp edge right here. So the parts that you need to know. This flattened part is called the glenoid cavity. If we look at our skeleton guy here, this is where it articulates with the humerus here, where that humerus bone fits in there. Okay, you can see. See that? If we were to take this bone off the skeleton right here, I'm holding it just in the same orientation too. The coracoid process is, if we find, well, let's start here with the spine. This is called the spine of the scapula. And if we follow it up to the edge, this is the acromion. So the acromion is that projection off the scapula that's just off the spine. The coracoid process then is this other little projection that's right on the glenoid cavity, right off of it. Now these projections, you kind of feel them sticking out in your front of your body, anterior part of the body, and that's an attachment point for many ligaments, tendons. Other parts that you need to know: the subscapular notch right here, the medial, lateral, and superior border. Okay, so these are the superior would be the top border of the scapula. And we got to think about how it's positioned in the body, right? Correct anatomical position. The lateral border would be on the lateral side of the body, so right there, and then the medial border. And that is the scapula. The clavicle, you just have to know which one's the sternal end, the medial end, and then the acromial or lateral end. The clavicle articulates with the acromion on the scapula. So it's called there's a joint that forms there. The humerus. Let's pull out the humerus bone. So here you go. Of course, you know this is the humerus, right? Very funny. But I know it's the humerus for its markings as well. It's a nice rounded head of the humerus right here. You also need to know the greater tubercle, which is this part of the humerus. Okay, so the head articulates with that scapula, so it would be turned that way. This is actually the wrong humerus. It would actually be on this side. I know that for a few reasons. One, the head needs to be faced on the medial side, but also if you look at the bottom, there's a few divots, little fossa. The deeper divot is called the Ocrian fossa. That'd be on the posterior side of the humerus. And other things to note about the humerus. Let me see, on the anterior side, the other little depression is called the coronoid fossa. So Ocrian is the bigger one on the posterior side, and the coronoid on the anterior side. Where the humerus kind of seems like it's supposed to be straight, but it kind of curves a little bit, that's called the deltoid tuberosity, which is of anatomical importance because your deltoid muscle actually inserts at that position on the bone. At the distal end here, this is called the trochlea. Kind of looks like a little spindle. And then the capitulum. And then we have the medial and the lateral epicondyle. And I think those are all the parts of the humerus. The humerus can get a little bit confusing, so I would go over that a little bit more. The ulna. Okay, ulna by itself, you know it's the ulna because it has this notch, which is called the trochlear notch. Notice that the trochlear notch fits into the trochlea of the humerus, and this part is called the ocrinon process of the ulna that goes into the ocrinon part of the humerus. And the other little point in the front here is called the coronoid process that fits into the coronoid of the humerus. So it all has a purpose for how it's named here. This is the head of the ulna. Oh wait, yep. And then the little point here is called the styloid process of the ulna. So if we look in the wrist here, I don't know how well you're going to be able to see that. To see how there's like a pointy edge right here, and here's the ulna over there. Oops, right there. Those are the styloid processes. Next, we have the radius. The radius I always know because the head is very, 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 very flat. Okay, that's the proximal side of the radius that kind of, as you supinate and pronate your hand, it turns in the ligaments within there. You also, the other side is the styloid process of the radius. And then the neck right here on the other side, the neck. Head, neck, styloid process of the radius. The hand, all right. So I went over the phalanges, the metacarpals, but the 8 wrist bones. Your book has a mnemonic that I actually think is pretty handy dandy. But the hand is probably one of the more confusing bones to name. The 8 carpals, I should say. The mnemonic is stop letting those people touch the cadaver's hand, right? So you have to have the hand in posterior, think of it posteriorly in anatomical position. And here's the radius. So we're looking at my right hand here, radius ulna, radius, okay? So this would be the thumb. These are the bones. Stop letting those people touch the cadaver's hand. And those stand for the 8 bones in the wrist. The scaphoid, the lunate, the triquetrum, pisiform, trapezium, trapezoid, capitate, and the hamate. I said one of those wrong. That's okay. Moving on. We got to go to the coxal bones. Let's grab it. Okay, so of course you have 2 in your pelvis. Here's one that I have. Oh, kind of like how do I orientate this? Okay, remember it's good to find this was called the orbiture. No, this is called the acetabulum. And then the orbiture foramen is this big hole. So we look for those 2 things together. This is where the head of the femur articulates or goes into the so that's where that fits. That's called the acetabulum. This large hole is the orbiture foramen. And then you have your ilium, your ischium, and your pubic bone. Your ilium is this bone. Your ischium is your butt bone, the one you sit on right here. And then your pubic bone. So this is actually your right hip or your right coxal bone. So ilium, ischium, pubic bone. The acetabulum faces out or towards the lateral side. So let me grab the other bone here, the other pelvic bone. They go together. Where they meet is called the pubic symphysis. Notice how it forms like an arch here, right there. That's called the pubic arch, right here, pubic arch. Hard to do without a third hand. Okay, so pubic arch. Where the pubic bones meets, you actually have cartilage there called the pubic symphysis. The ilium, this part is called the iliac crest. And then you have, make sure it's orientated correctly, you have the anterior and the posterior iliac spine. So you got to make sure you're thinking about it in a correct anatomical position. This is the front of the body, the back, so anterior, posterior. And then on your ilium, this bony projection here is called the ischial tuberosity. This is if somebody has a bony butt, this is what they're digging into, their ischial tuberosity. Their ischial spine is this little projection out of the ischium right there. And so lastly, this notch right here is called the greater sciatic notch. It's where the sciatic nerve kind of goes out to go down to the leg. Next is the femur. We have the head of the femur, the neck of the femur. So the head articulates with the right pelvis here. Okay, with the coxa, right? So this is the medial side. Okay, medial.